Good evening, everybody, and welcome to tonight's Facebook Live with Breast Cancer Now. I'm delighted that you're all joining us tonight on this cold evening. I hope you're all well. Just a few housekeeping rules to begin with, and then I will introduce you to Marita, who will be talking to us tonight about specialist bra fitting. So first things first, any questions that you have, please do pop them in the box at the bottom, and we will get through as many of those as we can tonight. Any that we don't manage to answer this evening, we will reply to in writing in the next couple of days, but hopefully we'll get through as many as we can this evening. We're live for about half an hour, 40 minutes or so. We have a couple of other Facebook Lives coming up. The next one is a Q&A on Thursday, the 27th of February, and that is with our nurses, Catherine and Lou. So if you've got any questions about anything to do with breast cancer, you can just send those in advance or ask them on the night. As just a reminder that these sessions are recorded, so anything that you say will be on saved on YouTube. So if you've got anything personal or private that you want to ask, just bear that in mind. And other than that, I think that is the main things. Finally, yes, there's an evaluation form, but we'll pop that through at the end as well. So at the end of this, if you'd like to fill in an evaluation, we'd really appreciate that. We do find them really helpful for planning our future sessions. So without further ado, I am delighted to be joined tonight by Marita Lewis. Marita is a very experienced specialist bra consultant and prosthesis consultant too, and she works with across the NHS fitting bras, and she works with surgeons and with breast care nurses, and she also does virtual fittings. She's going to talk to us in a lot of detail about all the work that she does and all the experience that she has, basically, she is an expert in her field, and if you're having difficulty finding a bra that fits, I'm sure Marita will be able to help you and give you some advice and some information about where to look and what to find. So thank you, Marita, and welcome.
Thanks, Katy. Thank you, Katy.
You. So I don't know if you want to start by just giving a little bit of an overview of your role and your
Sure.
background. And
Yeah, sure.
we have had some questions that have come in already, and we'll go to
Wow.
those afterwards. But
That's,
if you're happy to just sort of introduce yourself, that
of
would be
course I am.
brilliant.
Of course I am. Thanks, Katy. So, I come from a nursing background, so I am a clinician by trade. But I got involved in prosthetics, believe it or not, it's my 40th year. So I've learnt a lot along the way, and yes, prosthesis has evolved, and so has bras. So for me, I'd like to talk a little bit about the patient journey, really, what patients go through and what we expect and what we look for. So first and foremost, as you know, I work very closely with surgeons and with breast care nurses throughout the whole of the UK, and they come to us for a lot of advice. So first and foremost is tape measure.
Yes.
Most important tool when we're looking for a bra. I know there are people out there that they can say they fit by eye, but I think for me, from a connection point of view, we're talking ladies and patients in mind here now. The tape measure is our important tool. Once we put a tape measure around, we get a close connection to our ladies anyway. But also, I know then how she will feel with a bra on, and it's to talk to the lady as well and say, how does that feel? So the minute they put tape measure around, they tell me really what size they're going to be. So there are a couple of ways of fitting for a bra, and that it can be complicated, but it's not necessarily complicated. What we do is we add inches, and some companies don't add inches to get the band size right. We get that, and then we do the cup size. Now with the cup size, what we do is it depending on the surgery. If the lady's had a mastectomy, obviously we measure the remaining side. If she's had some sort of either lumpectomy or she's had a reconstruction, if there's a difference in size, we measure both sides separately so that we can see if there's a difference in the size. Now when we do that, then that's when we advise the bra size. Now once we do the bra sizing, and I can go through a lot of detail with that at a later date, but once we go through the bra sizing, it's just as important to get the style of the bra right as well. So for me, it's like when the ladies first had surgery, her arm movement's going to be limited. So we go for a front fastening, soft cut cotton bra,
Yeah.
something similar to this kind of bra. That we'd recommend for a first bra post-operatively. And then if the ladies had a mastectomy, they would put a softie inside the bra to balance themselves out, or even use a softie for a partial, just to get the balance if there's a difference in size.
And
So
a
that's something
softie,
we
just
use.
to clarify, they're really soft prostheses, aren't they?
They're very, very
They're not made
soft.
the ones made of silicone that people
No,
might
no,
be
very
aware of.
soft.
No.
It's a temporary prosthesis. It's usually there for about 6 weeks, and it's usually a cotton-based, very
Yeah.
lightweight, just a little bit of a shape, just to put in the bra, just to give them something to give them shape. That's it. It's nothing to
Yeah.
do with postural issues at
Yeah.
that stage. So that's for the first 6 weeks. We recommend something front fastening and easy to wear. There's lots of bras out there that's available to ladies. That's just an idea, that front fastener that I've showed you there. I showed it in pink because some people go, oh, there's no colour out there. You
Yeah.
know, it's always black, white and nude. Although they're the base colours for everybody, it's nice to show colour.
Yeah.
Yeah. Then what we try to do is educate ladies and say, well, aspects of a bra as well. So when a lady's particularly had surgery, but even anyone if they've not had surgery, these are the type of things that we're looking for in a bra. We're looking for a definite separation in the cup. Yeah.
Mhm.
Sufficient depth now, depending on the surgery, as to how much depth is required in between. If a lady's got to wear a prosthesis, we obviously need to cover the natural breast and cover the prosthesis. So that should be sufficient depth there. The other one is side depth as well. Sometimes ladies are left with a little bit of what we call excess skin, we call it dog ear effect or whatever, and we need to tuck that in after surgery so it's comfortable after. And that's something that really, really can be very uncomfortable if we don't get it tucked in. And ladies are very much aware of that. So
Yeah.
sufficient depth
So
at the sides is just as
so higher
important.
sides is
Absolutely,
yeah,
yeah.
absolutely.
And again, it's appropriate to size as well, because depending if somebody's a 32 band versus a 42 band, there's going to be a difference in the depth at the
Mhm.
side. Now, hook and eye at the back. This has got a 3 hook and eye, and it's got a 3 hook and eye to the back adjustments as well. That is then allowing the back to give support as well. So we like that bit of support around the back, to give everything up front the support it's needed as well. So those are things that we look for in the bra. And finally, the adjustable strap. Adjustable straps. Now sometimes bras will have a little bit of padding on the shoulders, and that will limit the adjustment. So we just need to be aware of what the style of the bra when we're doing that, you know.
Yeah.
So those are key elements to that.
So
Now when
going
ladies,
back to, sorry to
no,
interrupt you,
go on.
Marita, going
Okay.
back to the hook and eyes, when you're
Yes.
fitting, is it
Yes.
better to fit on the tightest hook and
Well,
eye?
I would say what we tend to do is either the loosest or the first or the second hook and eye in. If you're going on to the last band, it means you can really go down a band size,
Yeah.
because you're going really tight, so you don't
Mhm.
necessarily do that. So if it's on its first one, I think about where, and especially with people's budgets the way they are these days, it's probably to be better to fasten on the first or the second. Now if you've got four, first or second, so you've got somewhere to go. So
Mhm.
that's where I'd start. That would be my starting point. And it allows then for a bit of wear and tear.
Bit of
So that
stretching.
if
Yeah.
it stretches, they can go a bit tighter.
Yeah.
If you are putting it on the first fastening and you're struggling with that, then you need to go up a band size.
Yeah.
So then we make that adjustment as well accordingly.
Lovely.
Yeah, that makes sense?
That does. Thank you.
Like,
And just as far as band sizes, because I know this is a
yes,
question we get asked quite a lot on the helpline, and certainly I
yeah.
know nurses in practice get asked it as well, is how wide do the bands go? Because I know that sometimes
We
people
can
find it
get from a
difficult.
28 to 50. 50 on average is about the widest. And what I tend to do is if anybody's beyond a 50 band, we will adjust it in the cup.
Right.
So we make the
Okay.
adjustment in the cup. So
Yeah.
if somebody was like a 50C, but they went to, and they were a 52B, we'd do a 50C. Do you know what I mean?
Right.
So
Yeah.
we'd make that adjustment. Worst case scenario, it's a bra extender
Okay.
if
Yes.
somebody was beyond a 50 band. We don't find too many ladies like that, but if that was the case, that's what we would do. Yeah?
And if they were smaller, 28 the smallest band
28 the
generally?
smallest,
Yeah.
yes. I tend to find even with teenage bras, you know, you can get a 26 band in a teenage bra. but you know, you'd be really, really petite. But you'd look at the structure of the bra then, because it'd be too soft, maybe, to
Yeah.
support anything up front. So, you know, yeah, we can make adjustments though, put darts in. You know, we can get a machinist to put a dart in if we needed to take a
Yeah.
28 in. Again, that doesn't happen very often.
No.
The other thing I was going to point out with a lot of the bras, especially after surgery, pockets in bras, is a choice thing for me. It's very much a choice thing. If you went to the United States, they would say every lady who's had surgery would be labelled, they've had a mastectomy, they would be labelled and have a pocketed bra. In the UK, it's a choice. It's personal preference. Some people like the prosthesis next to the skin, some people prefer it in a pocket. For me, the main reason for a pocket is for security and for comfort if they don't like the feel next to the skin. So it's those two things that I would say would be a choice thing for me. So it's personal preference from a pocket point of view. Yeah. Some people don't even know that they don't have to have a pocket in a bra, but it's personal choice. So
And bras can be adapted as well. So if you've got a favourite style of bra that you like and it doesn't come with a pocket, you can
yes, you can
buy
have a pocket
pockets
put
to
in.
have
Yes,
them and
a
have
lot of
them
our
fit.
bras that we choose because they're regular bras, the lady can then choose which side they want pocket in. Now, some bras come with both pockets already in the bra, and then they can just choose whether to use it or not, as the case may
Yeah.
be. Again, personal choice, and that's our job to guide those ladies to make that
Yeah.
choice. Do you know what I mean? And help as to why they're thinking or considering that. If a woman was going to look at maybe 3 bras, I'd say definitely have one pocketed.
Yeah.
If you have one pocketed, then that means you can know the difference between how it can feel and
You've
not, as
got
the
the
case may
option,
be.
haven't
So
you?
that would
Yeah.
make sense, yeah? So from that point of view, you know, those are the aspects. These are we guide ladies as to, on their kind of, let's say, journey, where we would take them, you know? So very often, if you look at that bra, we would say that's a very functional bra. It's not really fashionable, but it does a really good job, and it's very, very
And it's
comfortable.
comfortable. Yeah.
Yeah. So, but then ladies are saying, well, you know what? I want to be feeling feminine. I want to feel sexy. I want to feel, you know, good about myself. Well, we can go down that road later on. So what I always do is when I take, and all my team do this, when we're in clinic, we show them a really nice, sexy bra. You know, something like this. And that's to say, it's red. It's really, wow. You know, anybody would wear that bra, wouldn't they?
Yeah.
You can wear a prosthesis in that bra, no problem. This is actually a flexi wire, so it's really easy to wear and it's really lovely up front. We use this a lot for our custom breast prosthesis, you know, the made to measures that we do.
Right.
But what a beautiful bra. So we can aim for that, and they can wear a normal prosthesis with that bra, no problem, and we can pocket it up front if needs be to make it adaptable for any ladies.
Well,
Now,
that's great because I know I've just we did have a question in from
yes,
Ali who she's a 27-year-old mum post
yeah,
cancer surgery. She's had
yeah,
a left mastectomy and she's just had a stoma operation as well, and she
that's it,
wanted some nice lingerie options. So
right.
that sounds like that would suit. And did you say it comes with matching knickers as
Oh yeah,
well?
that's the, you know, that's the set and that's the brief.
Yeah,
Yeah, that would probably sit underneath the stoma, I would say, probably because
yeah,
that, you know what I mean. But it's a lovely set, really
yeah.
sexy. You know what I mean. So you know, we look for things like that. Now, if depending on her look, she
Mhm.
might think, well, I actually like t-shirt bras. So
Yeah.
I actually brought that with Ali in mind.
Mhm.
This is a t-shirt look, and
Okay.
again,
Yeah,
it's really pretty,
that's
and that comes
lovely.
with
Yeah.
matching knickers as well.
Yeah.
So, you know, those are really, I think, very attractive bras. Anybody'd
Yeah.
wear these.
Yeah.
Regardless of whether you had surgery or not. And to be honest with you, that's exactly what I was wanting to do when I started this off. When I started with Womanzone, I wanted to have a choice of any kind of bra for any type of surgery, for one thing, but any type of event as well.
Yeah.
So we do, you know, like weddings. People think they can't wear a strapless bra with a prosthesis. Well, you can if you know where to look. So, I mean,
Mhm.
I've got one here, and honestly, I've used it so many times. It's a strapless bra, similar to the Halo, the red, yeah,
Mhm.
but it's got that tack at the top, so it holds everything at the top. So
Oh
you
wow.
sit it
Yeah.
over the prosthesis,
Mhm.
and that is a strapless bra. And
That's
that is something
brilliant.
that people just don't
Yeah.
know about and they didn't know they
Yeah.
could wear. And that's where we want to be. Well, I dare to be different, really. We do fashion shows. We've used bralettes in fashion shows because it's supported either end of the prosthesis. Just things that they didn't know, people didn't think they could wear, where we dare to be different and say, yes, you can. Why,
Yeah.
who are we to say you can't? Do you know
Yeah.
what I mean? And I think that, by going out there and looking for the right stuff for our ladies, I feel that we've got everything that we need. Sports bras are a big thing as well.
Yes.
Especially after, I play sport myself, as you know, Katy. And it was what I made it my mission that, I think, well, regardless, I've known many a girl that plays hockey or football or whatever, they've had surgery and we've put them in the initial starting bra, but then we've put them in sports bras afterwards. So this is one that I use quite a lot. This is for a smaller breasted lady, and you can see, you wouldn't think that you get a sports bra with a shape.
Yeah.
And you can detach the straps and they come in at the back. Now I've used this for lymphedema patients as well.
That's interesting. Yeah.
Because the straps are padded, I'll show you. So we've got a slightly padded strap. So that sits comfortably on the shoulder, but just in on the shoulder, not on the shoulder. So there's no discomfort to the shoulder area. And because it sits quite well in at the back, as you can see, it's quite well in at the back.
Yeah.
So there's no chance of it falling off your
Yeah, the
shoulder,
shoulders. Yeah.
which is one thing. It's got a little bit of adaptation at the top here. And you can adjust these by taking this off and crossing them over and make it into a crossback.
Right.
Really, really clever,
Good.
So we have
Yeah.
a sports bra range that I think will suit anybody's needs. What I have used the sports bra for, not just this bra, there's another one here. I've used it for, when I've used it for lymphedema patients, this one's got, as you can see, almost like an Airtex front.
Yeah.
No, so when they're
So
wearing
is
a
that really
prosthesis,
soft?
it's really soft and it's got that same back.
Yeah.
It's in at the back, and the padded shoulders again. So for sport, it's ideal. But I've used this for breast edema. When the ladies are presented with breast edema, we put a prosthesis over the where the breast has got the edema to keep it cool and to massage the breast area
Right.
because it's usually quite painful. With a good supporting bra like a sports bra on top of where the pain is, we've eliminated the pain. It's been that good.
Yeah.
So we want to do some trials to show how good this works for edema, breast edema. I noticed there was a lady that was talking about her edema and she was saying she's got lymphedema under her arm.
That was Caro, yeah. And she said it's always feeling tight and uncomfortable. So
Right,
how do
so
you
I'd
get a
say
bra that fits
there's
well
a
for
couple of
that?
issues there. I'd say that she probably needs to be remeasured
Yeah.
and restyled. The remeasuring just to make sure we've got the right fit and it's not too tight, for one thing. It might be that the swelling has to be catered for, so that the adjustment in the back would like to be good adjustment. And then the depth at the side needs to be looked at to see, is it soft enough for her? You know what I mean?
Yeah.
So, or
And is it
it could even be
supporting
the
there
opposite
as
way
well?
around. It might be that she needs added support, Has she got a bone in the side? Because sometimes there's a bone at the side that they're not aware of.
Yeah.
So that needs to come away if it's on that area. So there's lots of things that probably she needs to look at to see, how we can help. But certainly, the places I'd go is measure first and style. Get both right. But now that we can do different things to help edema.
So if you have, would you say not compression, but a support? So a sports
Support.
bra is
Definitely
good,
support.
but
Yeah.
but you don't want
Definitely
anything
support.
that's too
Compression might be
tight.
too much.
Yeah.
Sometimes compression can work if it's immediate. But if it's a chronic condition where it's ongoing, it's not going to work all the time. Sometimes they use what we call kinesio tape, and it's a tape that they tape in the area, and usually a lymphedema specialist would do that and tape the area. If it was in the breast area, that's when we use the breast prosthesis to massage the area. But if it's off the breast area and more under the arm, there might be some tape that might be needed, or a little pad with little we call it little knobbles on it, and that helps to shift the edema. A lymphedema specialist should be able to help her with that.
Lovely.
If it's chronic, do you know what I mean? Yeah. But to help her pain, if it's that much, we need to readdress the bra.
And would a bralette be good in that situation as well? Or is that not supportive
I think it
enough?
won't be supportive enough.
No,
I probably
okay.
would say she needs it's support that she needs, but
Mhm.
it's the right kind of support, but the fit has to be right and the
Yeah.
coverage has to be right. I'd like to see her really. You know,
Mhm.
if she's in touch, I can see her virtually and get
Yeah.
her measurements and see if we can help her.
Lovely.
Okay,
Thank you,
does that make
Marita.
sense for her?
It does. Yeah.
Okay.
I
Um,
just, while we're just talking about post-operatively, I think we've
yes.
probably covered this, but Star has put a question in saying, I'm having a double mastectomy and after the surgery I need to put on a bra, but I don't know what size I should be getting.
Right.
So I
Okay.
understand there might be some swelling involved.
Sure.
So,
So, depending on where she's based,
mhm,
hospital-wise, as to what they would, use, some hospitals don't even provide a post-op bra. Some hospitals do. So it's a bit of a
yeah,
postcode lottery on that one, Katie. But I would say that if she needs advice, what she needs to do is we measure the band, get the band measurement, and then cater for that because this particular one comes in like a small, medium, and large.
yeah,
So the medium would be like a 36, 38 band, and so
mhm,
it would cover the two sizes if that makes sense.
yeah,
Uh,
okay,
she can choose her cup size. So what you find is when ladies are having bilateral surgery, what they do is if they've been very large, they definitely want to downsize,
mhm,
because they have that choice. Usually, and the opposite way around, if they've been very small, they want to go a bit larger,
yeah,
which is their
okay,
personal preference. So the cup size is their choice, but the
yeah.
band size has to be a measurement. So if
And
she
would you say just to make it a little bit bigger immediately post-operatively to sort of
she
account for
still
the
needs a bit of
swelling?
support because what happens if you go too loose, it'll ride
Mhm.
up.
Yeah,
Because
okay.
don't forget, if she's only wearing a very soft prosthesis to start off with, there's no
Mm,
weight to anchor down. So because there's going to be no weight to anchor down, and she puts a soft bra on, the minute she does that, it's going to ride up.
going to go,
So it
yeah.
needs to fit her reasonably well. So I just put as a tolerable, whatever tolerable to her,
Mhm.
um, and gauge that. Now these bras you can get overnight. Do you know what I mean? So
Mhm.
once she's measured, you can get something like this overnight. Pretty well. Most of the companies can provide something quite quickly. So it's when she's had a surgery, measure her torso. Then just get the one bra,
Yeah.
just to tide her over with her softies, and depending on where she's based as to what I can advise for her. Do you know what I
Mhm.
mean? Because I know pretty more or less most of the hospitals in the country. Do you know what I mean?
Yeah.
Um, and then once she's got out of that phase then and she's comfortable and settled down after a surgery, a few weeks later, maybe she might downsize. We don't know. That swelling could stay there for quite a while. Do you know what I
Mhm.
mean? So it's just one at a time really. Don't waste our money a lot. That's
Yeah.
the other thing I find frustrating is women go, oh, that feels great, and they buy a load, and then it's not so great in a week's time. Do you know what I mean? So
Yeah. And that's the
um,
thing, isn't it? It is a process. You were saying it's a journey, but
it is.
it's the same with the bras, isn't it? You will need to be measured more than once.
Absolutely, absolutely.
Yeah.
And depending on the treatment,
Mhm.
depending on what kind of treatment, especially after radiotherapy, you're so tender. You know what I mean? You don't want to be buying
Mm.
bras that are structured and tight and uncomfortable. You know
Yeah.
what I mean? Buy something that's soft and easy to wear while you're going through that bit phase, and then look at something more structured again later on. Do you know what I mean? So, yeah, I'd say continuous for the first 6 months. Make
Yeah.
sure and especially if you're contemplating further surgery, because usually if you're contemplating further surgery, you're left with a little bit of skin
Mhm.
behind, and that can be a bit uncomfortable to wear, something on there. So, it's just looking at comfort. And that's why I said, as much as we can go sexy later on, we need to be comfortable initially. Do you know what I mean? So
Yeah.
we stay functional to start off with. And
Yeah.
then I always say, trust me. Trust me
Yeah.
first, because I know what I'm doing. Go down this road, wear this bra for now, and then when we're ready, and we will be ready, we'll go down the sexy
Yeah.
road, the feminine bras later on. I mean, I think they're nice enough anyway, but some ladies are, sometimes expectations are a little bit unrealistic, and I just kind of try and say, yeah, we'll get there, let's be comfortable. Because you
Yeah.
couldn't wear that bra straight away after surgery, it'd be
It'd be
agony.
too uncomfortable.
Do you know
But
what
I
I mean?
think it's important as well to know that there are matching sets and things like that because
Absolutely, yeah,
yeah.
absolutely. And that's why I always say to my girls, make sure you take a strapless bra, a coloured bra, sexy knickers, so that ladies know what they can aspire to.
Yeah.
Just in a few months' time, just bear with us. until we get you there. And usually when we're fitting a prosthesis, I usually know when a lady's been wearing an underwire bra because of the shape they've got,
Yeah.
and say, look, we'll get you there eventually. So I'll fit a prosthesis appropriate so that you can wear a prosthesis because wear an underwire bra, because usually when they're fitting for a prosthesis, it's designed to last for 2 years at least. So we bear that in mind when we're doing our first fit for these ladies.
So when we're talking about reconstruction and how things change as well, and Mandy's put in a question here about how long do you have to wear the surgical bra for after reconstruction? And I know that varies according to what type of
Absolutely.
surgery you've
Yeah.
had, and
And
also
it's,
often to do with the surgeon's preferences,
sure,
isn't it?
exactly that, exactly that. We have lots of surgeons, they have their fads. I call them their fads. You know, they call we go from compression bras, recovery bras, to even these lightweight bras, and all the surgeons, you know, you've got to be able to cater for all their needs.
Yeah,
Um, it depends on people's sizes as well, you know, because if they're larger breasted, usually have to sleep in their bras for the first 6 weeks
yeah,
anyway. So we need a bra that's comfortable to sleep in. So a couple of the bras I've shown you already. If somebody was very large breasted, we have a bra called Downtime. And this is amazing, but this starts at an F cup, and that
okay.
is a sleep bra. It's a double layer. Um, it's double layered and it's quite well structured. So that is a sleep bra. For your first 6 weeks, it'd be really good. But it's not compression. It's just comfortable. So some surgeons don't want compression at all. They just want the lady to sleep in a supporting bra so that they're not going to fall, and they want to
Yeah,
keep the position of the reconstruction. If they want compression, we do strong. There's different types of compression. It depends on the consultant's advice really, and we work with them to say what exactly is it that this lady needs.
yeah,
And they're usually well instructed by either the surgeon or the breast care nurse. If we were in doubt, I'd question it and say, I'm not so sure that's correct, because I'd know from the size that they're giving us as to whether that's the correct type of bra, and I would question it with the hospital first before we put them in that kind of bra, especially if they've got a sleep in it.
yeah,
We've got to make sure, because
yeah,
sometimes a compression bra, when you pull it around, and if it's not quite the right fit, you know that kind of pressure is too much. You know, we don't want ladies in a lot of pain. Now in Nottingham, they use this bra to sleep in.
okay.
You know, so it's crazy really, because
Yeah,
there's no compression in that, but there's separation in the cup,
yeah, and it's
and it's very, very
supportive. It's got the
comfortable.
band
Yeah,
underneath as
yeah,
well. Yeah.
yeah. So every lady who has reconstruction has that bra on. So it just depends on the surgeons as to what they advise really.
So, and Irene as well, talking about reconstruction, how do you stop the bra edging, digging in underneath your implant?
Right, so I would say that again's down to the fit.
Yeah,
I think you've got to be remeasured. She needs to be remeasured, and it depends on if her scar is right underneath the breast area, then it might be that she needs to deepen the band, to go slightly deeper with the band. As you can see, that's quite. If you look at the structure of that, it's quite deep underneath the cup.
yeah,
So maybe go slightly deeper and make sure that that band here is sitting correctly around the body area. So I would say two things again. It's a styling and it's a sizing issue. Yeah. If she's got a bit of chafe in there, it might be that she's not got enough support in the bra, so she needs that lift. So it might be that she needs to give the straps a little bit of an adjustment to give the lift, you know what I mean? So she should
yeah,
have that, you know, should have been told that really anyway, but those are the things I'd be questioning really, Katie, to see
yeah,
if we've got it right for her.
yeah, and making sure that the wires are in the right places as
Well, if
well.
she's wearing wires, you know,
Yeah,
that's another thing. If she's wearing wires, she really needs to be questioning her fit. You know, if the
yeah,
size is correct for her.
yeah,
Yeah. When I talk about wires after lady, I would go more flexy in the wire, not a strong wire.
yeah,
So if it's a flexi wire, then it'll move with her. If it's a strong, rigid wire, then that might be what the whole reason why it's causing her a problem. That would be another thing I'll be looking at is she wearing wires.
yeah. Okay,
Does that
so
make sense?
it does
Yeah.
absolutely. Yeah.
Okay.
Um, Lorraine has sent in a question as well.
Yeah.
I have problems trying to find K-cup bras. 3 years after surgery, I'm still having problems with the bra taking off the top layer of my skin. This
Okay.
is a problem because I'm immunocompressed due to medication for secondary cancer. I have to wear a
Right.
prosthesis at the same time.
Okay. So, depending on her band size, that
Mhm.
would be, she might be a K-cup. We can get K-cup, no problem. You can get a sports bra from Royce. It's a K-cup and it's really good. Um, if she wants to wear wires, there's a bra called the Bell, and that's Fantasy Bell. Now I did a made-to-measure breast form with a K-cup lady,
Mhm.
because there's no, depending on, as I say, a band size, but there's no prosthesis out there, if she's a mastectomy lady, that's big enough to cater for a K-cup.
Right.
Guaranteed. So we have, depending on where she's based, we've fought a lady's case and said there's no way we can fit a prosthesis for this lady. She needs to have custom made to measure, because, like you say, she's got no choice in this matter.
Mhm.
Sometimes ladies have no choice. Some ladies, when they are K-cup, they are offered usually a reduction.
Yeah.
If the lady's not fit for further surgery and this happens, then she has got no choice. So if that's the case, she's got to be offered a made-to-measure prosthesis to allow her to be balanced.
Yeah.
But yes, if she likes wires, there's the Bell that goes into a K-cup. And if she likes a sports bra, there's a Royce sports bra out there that's really, really good, and they support really well. The Bell gives a nice shape. The sports bra is comfortable and does the job, does the support, depending
Mhm.
on her band size, mind.
Yeah. So it sounds like she might be worth getting in touch with you as well.
Yeah, yeah,
And
I'm
just
more
to
than happy to.
say, all of your sort of contact details are in our literature as well.
Absolutely.
You can find the Women's Zone
Yeah. I'm more than
details
happy
in
to
that.
help anybody. Anyone needs my help. And the
Mhm.
virtual thing is really good, because,
Yeah.
it's like I'm seeing somebody from Scotland tomorrow virtually, because I can't get there up there. But I know I can give just as good a service virtually as I can in person. So long as I've got to take measure the person that's doing, what I do is instruct a person, partner, a friend or whatever, how to do it. I use a torso to demonstrate. And I
Mhm.
say, right, if you take the measurements for me, then I can guide the lady as to what her needs are.
And do you do that sort of over Zoom or something like that?
Zoom, WhatsApp,
Yeah.
whatever's easiest for the ladies, yeah.
Mhm.
So mainly those two, Zoom and
Mhm.
WhatsApp. And what I tend to find is it's the older ladies that like the WhatsApp better. Do you know what I mean?
Mhm.
The high tech people use Zoom and whatever. But once we've got the measurements, I usually ask for the lady to show me how she used to look before
Mhm.
surgery, so I can see what type of bra she did like before the surgery, because I want to keep that as close as possible,
Yeah.
ongoing, so we know what we need. If somebody likes to wear t-shirt bras, great. If they like to wear lacy bras, then great. I have an idea how she liked to look, and then we can guide her then after, when we've done the measuring, as to what type and style a bra for her, and that works really well, to be fair. It works really well.
Excellent. Thank you.
Okay.
Um, and we were talking before about radiotherapy as well, weren't we? And I think
Yes.
there was Sophs has sent a message in saying, what are the options for bra fitting between the operation and reconstruction and reconstruction while you're having radiotherapy?
Okay. So I think the key is again down to size, depending on the breast size and what, style. Once we know what size the lady should be, once we get that sizing right, then the styling comes into it. So that is part of her styling process. So she needs something soft, she needs something easy to wear, and she needs something that I would say comfortable on her skin particularly.
Mhm.
I would also say, depending on whether she's had a mastectomy or not, because she'd need something quite cool on her skin, because obviously radiation creates a lot of heat.
Yeah.
So a cool material on the bra and a cool prosthesis would be ideal for her, you know. So
Mhm.
something really cool, cotton based or microfiber
Natural
is
fibre.
usually a
Yeah.
good thing. Again,
Yeah.
depending on a size.
Yeah. And
Yeah.
trying to avoid seams and itchy material
Yeah,
like
seam
lace
free
at
is
the beginning.
ideal.
Yeah.
Seam free would make a lot of sense. But yeah, something very, very soft and cool on the skin would be
Yeah.
ideal for her. But again, supportive depending on her size.
Yeah. And you've got examples of those as well there, haven't you?
Yes,
Like,
I have.
yeah.
Well, I showed you this one before. This one, now she would think she couldn't wear that because it's lace, but it's
Right.
not. It's so soft you can't even feel this. You can't even feel it. So we've had a lot of ladies wear that after radiotherapy, and it's got a double band underneath. So
Yeah.
if I turn it around and upside down, it has a double. Can you see that? Like a double band.
I can't see too well on there, but it probably comes
There's
out better
one
on the.
band and then there's
Yeah.
two bands underneath. So
Okay. Right.
it's really comfortable and easy to wear. But there's a bra here. If she likes, again, I'm kind of working with people that I don't know the size. But
Yeah.
this is one and it's seam free the whole way round, and it's by Triumph, and it's got no seams whatsoever. So I'll just open it up, but it's a t-shirt bra, yeah? But what we do with this is, I'll just open it up so you can see, there's not a seam on it. So that has got no seams whatsoever.
That's
And
good.
it's
So.
called a Fit Smart bra, so it gives a nice look up front. It's a
Mhm.
t-shirt bra. So that
Yeah.
would be really comfortable, but it's just one of our surgeons doesn't like any seams on the bras, so we had to find a bra suitable for
And does
her
that have? So
ladies.
that doesn't have pockets,
Doesn't
presumably.
it's got a
Mm.
side pocket.
Oh, it has. Okay.
It has got a side
Right.
pocket, so that would work. But if they
Mhm.
wanted a pocket overall, we'd put one in,
Right.
no problem.
Okay.
But that is really nice for ladies who have had on radiotherapy. It's so soft, it's unreal, you know, so soft. But the fact that it's got no seams is ideal. Do you know what I mean? Again, appropriate to size. That probably would go up to. It comes in sizes 1, 2, 3, 4, and 5. It's a new concept for bras,
Right.
and
That
it's
is
by Triumph,
confusing.
yeah.
Yeah.
So, but it does have its size range on there, you know. So, like a number 4 would be a 40 double D. Do you know what I mean? So, off the top of my head. So there's a good size range to it, and it comes in nice colours. Like you can see, that's an ivory. It comes in like a blush and a black. So there's nice coverage on these. But I feel that I've got that much choice available to ladies. Just knowing what their needs are, you know, it would
And
be
where to direct them to.
absolutely
Yeah.
no problem whatsoever.
And I
No
think
problem.
you touched on it earlier as well about budget, and a lot of the time we do hear from people that these bras can be quite expensive.
Yeah,
Now, there is VAT, you can get VAT off your bras, can't you? But there's a
yeah.
bit of confusion, and I don't think everybody always knows about that.
So our particular products all are without VAT anyway. So if you go to, let's say this bra, if you went to Triumph for that bra, it'd probably be retailing about £46, but
Right.
we sell it for 40. Do you know what I mean? So we all sell it without the VAT anyway. A
Okay.
lot of our bras, Anita would probably charge like 59 and we charge 43. Do you know what I mean? Um,
Hmm.
so there's that, but we don't charge VAT because we're a non-VAT company anyway. Because we totally work with ladies who've had surgery, we're a non-VAT company. And the same with our swimwear, we don't charge the VAT on
But
anything.
if they didn't buy from you and they bought from somewhere else, can they
If
claim the VAT back?
they should be able to, Marks and Spencers do that, I know.
Yeah.
Yeah, most of the stores
And that's
do
for
that.
life, isn't it? After you've
For
had
life,
your,
yes,
yeah. So
definitely, yeah,
it's,
yeah.
yeah.
Absolutely, yeah.
And is
I
that,
think that most of the stuff we charge is competitively anyway. We're
yeah,
competitively priced, I
yeah,
think. We try to make sure we look after people's budgets.
yeah.
Um, we've looked after women when they just haven't got anything, you know what I mean, and they've had to apply for a grant.
Grant, yeah,
Well, I would not never see a lady without a bra, so you know what I mean. We know the hospital is that well that we just say, look, we've got something here that we can give to the lady, you know.
yeah.
So we've given out free bras in that way, you know, just to help people who are in that desperate mode, if that makes sense. And the breast care nurses know those people, you know what I mean? So
Mm,
they come to us for help if that's the case. So yeah, that's not even an issue. If we needed to help somebody, that's what we could do, you know?
good, thank you. That's great. That's great that you have that. Yeah.
Yeah.
So I mean, we've just recently we're just updating our bra fitting information, which I think you've had a look at as well, haven't you, about how we
Yes.
do it? And I think
Yes.
you've mentioned the key things about a well-fitting bra, the good
Yes.
separation, the good bands, the adjustable straps, and wide straps are better than the smaller straps, aren't they?
Especially with larger breasted ladies, yes.
Yeah.
Yeah, to help support them, yeah.
Yeah.
Um, we do, this is a chart, I don't know whether you can see it, but when we go out to training the nurses and anybody that's interested, but we do a step-by-step guide on how to fit for a bra. So that
Okay.
information there is a step-by-step guide. So we take that everywhere we go, just to help people You know, even like people on the wards, if they haven't got a clue how to fit, and especially if they're doing softies on the wards, that helps the lady just to talk through how to
Yeah.
fit for a bra. There are a couple of ways that we call our way conventional.
Mhm.
You'd likes of the, you know, some of the stores, we call them a bit non-conventional, because what they don't do is they don't give the room in the band that we would like them to have. So
Mhm.
they would then those ladies would become a customer, but to us they're a patient. So
Yeah.
because there's that difference, for us that's where we make sure we go conventional in our fit. So when we teach people how to do this fit, that's what we call a conventional fit. And it's where, when we talk it through, it's where we add inches onto the band,
Yeah. And
and that
it's how
makes
many
it.
inches do you add? Because
We
it
add
depends
we
whether
add
it's odd
four
or even.
inches on an even measurement and 5 inches on an odd measurement.
Yeah.
We've always got to arrive at an even measurement because bands come in 32,
Even.
34 and
Yeah.
so on.
Yeah.
So that's how we do it. And then the difference between that and then the cup size is how we gauge the cup size as well.
Yeah.
Um, it's a bit complex, but it's not, you know what I mean? When you talk it through and you go through it in a practical way, it makes sense. Do you know
Yeah.
what I mean? But some of the stores don't add those 4 and 5 inches. They might only add one. They might only go the next inch. And then what they do is over accommodate in the cup.
Which
Um,
is why you'll find so many different bra. You might be a different size in
that's
a
what
totally
causes the
different
problem.
brand. Yeah.
Yeah, that's what causes us
So.
problems. But I think for me, it's like it's not wrong,
Mm.
but from a patient perspective, it can cause a lot of grief because they can get a lot of that tightness can cause them issues. You know,
Yeah.
if they go to a shop like that and they fit on the tight side, it's very uncomfortable after surgery to do that. They might be able to go back there later on if they've been used to that way, but after surgery, it's too tight. We need
Yes.
to go down the conventional road for
Yeah.
fitting, definitely. You know,
Lovely. Well,
okay.
you're so knowledgeable. I could talk to you for forever. Is there
And
anything
you
else
know
that
what?
you
I
want?
love it. I love it as well. I love it.
Is there anything else that you wanted to discuss before we finish? Because I don't think there's any other questions that have come through. I'm just having a look through. Um, but is there anything else that you feel we should talk
I think
about?
when you talked about the band sizes, equally the cup sizes, you know, when you said about a K cup,
Oh,
and you know, when you go to bigger sizes, I mean, we are quite well renowned for doing our bigger sizes, but you know, there's some bras out there and you think, oh, when women are bigger ladies, they really struggle to get a nice looking, sexy bra,
mm,
or a bra that's not wired for bigger ladies. So there, that is one that we do, and it's an Alomi bra. And I don't know whether you remember, uh, I don't know whether you know that bra, the Triumph Doreen.
oh yes, yeah,
That's been a popular bra for many, many years,
yeah.
and it's still the world's best-selling bra, yeah?
Mhm.
Well, this is one that's come out by Alomi, and it's a soft cup, and it goes up to 48 band, and it goes up to a H cup.
Right, that's pretty as well, isn't it? Is that
Isn't
like
it?
is it a lacy sort of
It's
silk
quite lacy.
satiny? Yeah,
It's satiny bra. It's a satiny look. It's really
yeah,
nice. Yeah.
yeah,
But look at the underband underneath here.
yeah.
It's so
Very
well structured
supportive.
underneath.
Yeah.
So it will give an underwire look. So you could wear that more or less for your first fit, for your prosthesis.
Mm,
And how good would that look? You know, for a bigger lady. And
yeah.
then there's another bra here that we use, and you would think, oh my goodness, it's it starts at an F cup, and that goes up to your K.
Wow,
But
that's
it's got the
lovely.
cami look
Yeah,
at the front.
that's really nice. Yeah.
Isn't
And
it
does that
lovely
come
and
in
lacy?
different colours as well?
It's only in the black, but it's got
Mm.
an the underneath is cream.
Yeah,
It's
it
got
looks
like it's
really
like a two
pretty.
bras in one.
Yeah,
Massive, great support. Do you know
yeah.
what I mean? But it's great to know that these bigger ladies can be accommodated, and a prosthesis will sit in those bras.
Mm.
So it's nice to know when they are ready for their underwire bras. We've got some really good underwire bras for bigger ladies.
And that
Um,
might be something that Lorraine, who asked the question about the K cup, might be able to
Yes, she
use.
can
Yeah,
venture into looking at that, you know,
yeah,
as well as the bell and the sports bra. Sports
yeah,
bra for every day is great.
yeah,
They do a really nice kick up. Again, depending on the band size.
yeah.
You know, I don't know what band size she is, but yes, I'm sure that would be one for her to look at. Yeah. So
Brilliant.
bigger ladies now have got a much better deal for, you know, the
Mm.
choice. I think between, you know, it used to be the broad spectrum was in between, you know, sort of C to double D, even E. We'd have a great choice of bras, you know, for
Mm.
everybody. And then the smaller ladies and the larger ladies we struggled with. There wasn't much choice. Now we've got that choice, and I think anybody across the board can be catered for. And I think that's nice. And colour. The fact that we
Yeah.
can got colour, you know, I wanted to show that red one because I thought that is absolutely gorgeous. You know,
Yeah.
for Valentine's Day, we couldn't get enough of them. You know what I mean?
Yeah.
Because it was the right time to have a right red bra out. You
Yeah.
know, but yeah, it's just nice to know. I mean, as much as people want colour, it's not one that, you know, we don't do that much of it. We stock it, but we don't sell a lot of colour. It's always white, black, and nude.
Yeah.
Everybody's practical, unless they're on a special occasion.
Yeah.
You
Yeah.
know.
But it's reassuring to know that those options are there and you have those bras for
Absolutely.
special
And the briefs
occasions.
now,
Yeah.
most of the
Yeah.
bras that we show now have got matching briefs.
Yeah.
You know, and that never used to happen years ago. You used to struggle to get a matching brief
Yeah.
if you've had surgery. Now it's more, you know, prominent than not, as the case may be, which is great.
Oh. Well, thank you. Thank you so much for your time, Marita, and
No
all that
problem.
knowledge. It's fascinating, and hopefully
Oh,
that's answered a lot of questions for
I hope
people
so. I
watching.
hope so.
If you want to get in touch with Marita or find out any more about any of the bras that she's mentioned, we do have a suppliers list on our website, and if you have a look, it's like a directory of the lingerie and post-surgical bras and things like that. So you can always find Womanzone there, along with other suppliers as well.
Thank you.
And hopefully we will have Marita back again in the future to talk to us about prosthesis as well,
Yeah,
because
definitely.
that's your
I'll
other
be another
area of
interesting one,
expertise.
Katy.
So, so thank you, everybody. If you've got any questions that we haven't answered, we will try and reply to them tomorrow, or the next day. But I think it's tomorrow. We should be able to get through those. And please, if you've got any comments about tonight's Facebook Live, we'd really appreciate you
Yeah,
completing our evaluation. It's great to get the feedback and know what we're doing well and what you'd like more of, or what you didn't like, and that really. And also, if you've got any questions following tonight as well, and you want to speak to one of the breast care nurses, you can always phone the helpline, which is 0808 800 6000. And we're open from 9 o'clock tomorrow, so you can always give us a ring there if you've got any questions that you want to talk through with the helpline team. So thank you all so much for your time, and thank you ever so much, Marita, for your time tonight. It's very much
thank you, Katy.
appreciated.
Thank you.
Okay. Good night, everybody.